we'll show you the other battery-operated laser. So we'll talk about the different lasers at the end of the webinar. Okay. History of Microlite and ML830. To begin with, the Houston Laser Institute in 1980 was training surgeons doing laser and surgery certification, class 4 lasers. And in 1989, the first gallbladder surgery was done in America. It was done by the faculty at Houston, Dr. Rubio. And then it became laser surgery, and for the next 8 or 9 years, they trained. Basically, there was a great increase of surgeons that were flying to Houston to be trained and certified and credentialed by their hospital. They had to go through these courses, and the certification was done. And the CME group was the International College of Surgeons, and these are CME Category 1 credits, which are the only ones they would accept. And so the doctors came to Houston. They took a 3 or 4 day course that included laser physics, tissue interaction, laser safety, also an inanimate lab, and then on the second day, third day, they had actually animal labs, wet labs, with hands-on. So they had to go through a series of lectures and also the lab, had to take a test, they had to pass it, and then they basically were laser and procedure certified. So that's the process that went on, and during that period of time, there was in excess of 15 to 20,000 doctors, MDs, who actually flew to Houston and were trained. And so that's how Houston Laser Institute started, as basically the CME group of International College of Surgeons. So from this group, there was a doctor, a orthopedic surgeon called Dr. Smith, who happened to be in California, interested in cold lasers, had been teaching laser arthroscopy for Houston Laser Institute, but was looking for a cold laser to treat his patients for post-op pain. So in 1992, he happened to be at a conference in Europe, an orthopedic conference, and he spent that time to investigate and look at all the lasers that were available in the world, and this is where he found the Microlite laser. So Microlite laser was being manufactured in Denmark. He bought the laser, brought it back to America, spent the next year going through treating his patients for post-op pain, called one day on the phone and said, "This laser works, we're going to start a company." So that's where it all began. So Microlite laser actually came to America. The company was called at that time Microlite Corporation of America. They were the distributor for the laser out of Denmark. At the end of the study, 12-year study, and the approval by FDA, Microlite went to Denmark and bought the company. So that's a little bit of a history. American Society of Laser Therapy. This was a group that was started at the same time as Microlite Corporation of America. About a year later, it includes roughly 6,000 to 8,000 members, which is basically everyone that has a laser goes through and is basically a member of the society. We talked about the patent a minute ago, and again, it's a method patent. It says you can't treat a patient between 800 and 830 nanometers at 90 milliwatts of power, and it's already been to court and been defended. We talked about General Motors study, and we talked about Bader, and then we talked about the FDA clearance in 2002. All right, here are different protocols. There's protocols for inflammatory conditions. As you can see, there's some for pain management, fibromyalgia. Currently, we're in the actually the last year issue of Fibromyalgia Journal Aware. A great article written by Dr. Bernard Filner, who also is doing webinars on this with this webinar company that we're working with right now, and he has some great presentations on webinars, both on fibromyalgia and myofascial pain. And so I recommend that you have a chance to please see his webinars. Pain management's a big use right now. There's also a lot of use for TMJ, arthritis, dislocations, ligament arthritis, muscle injury. So literally it can be used for any kind of pain or inflammation. And because it's, again, a cold laser, it can be used over metal implants and pacemakers, no problem. Also, you can use it on inflamed cells. And one of the conditions that comes up, I'm sure that you've seen this in your practice, is a patient comes in with an injury, it's got inflamed cells, and you want to put cold on heat, and so that's why this laser is works so good on inflamed cells. It's 90 milliwatts of power, non-thermal. Here's the treatment process. Basically, you put the you identify the area. Let's say it's a myofascial trigger point, and you find the taunt band. You put the laser directly on the taunt band. The laser that Microlite is using, the Microlite laser, delivers 3 joules per dose in 33 seconds. It's all preset. You just hit a button, it goes off for 33 seconds, and you deliver 3 joules. And again, all lasers are dosed in joules. So the typical protocol is 9 joules per trigger point. And it means that you put it on the trigger point or the taunt band, and you leave it there, and you do it for 3 doses, or roughly a minute and a half. And what happens, it improves circulation into the taunt band, and then it desensitizes the C fibers. So you can go back in a minute and a half, and you'll find that it's released. So it works great on myofascial pain, works great on fibromyalgia. Typically, the treatment protocol is a couple of times a week until the end point. In some cases, it may be 5 weeks, and some patients it may be 2-3 weeks. It just depends on the condition. Each session will take between 10 and 20 minutes, depending on the severity. And that's pretty much it. It's very easy to use. And you'll find that in your practice where you've been using ultrasound or interferential, once you get the laser, they don't need to do that anymore. This laser does more than ultrasound and more than interferential. And it penetrates deeper. It activates, basically it doesn't use heat or electricity, therefore it's safe to use over any type of condition with no downside. And so you'll find that in most of your clinics that are using this, they'll basically cut back and quit using anything other than the laser, and no more use of the ultrasound or interferential. Okay, and typically the acute conditions are quicker to treat. Somebody comes in with a twisted ankle, they're going to get quicker relief than if somebody comes in with chronic pain. And chronic pain is going to take longer, and just like in the regular therapies that you do, recognizing that some patients take longer, and the ones that are new, the patients with acute injuries, typically respond a lot faster. And by the way, this laser also works great if you're doing any type of spinal decompression. In the past, they have been using a high volt on the patients post-treatment, and this laser works great on post-traumatic traction. And so you can use this laser instead of high volt, you get better results. And so that's another way to use it. So here are the 2 lasers, MLA30. They're both identical, same power, same wavelength. Class 3B, they're both 3Bs, 830 nanometers, 90 milliwatts of power, and patented. You'll notice on the battery-operated laser, there's 2 cases. One is an outer case silver, the other is an inner case, smaller case, and then you'll see the console there actually has a place for charging batteries. It comes with 3 batteries, and you put the batteries on there, simply recharge them and reuse them. And each battery holds between 50 and 60 doses. You can get a quick charge in an hour, and it works great. These lasers, we sold these 18 years ago under the FDA study. Our original laser was battery-operated laser, this one, and I have doctors that are still using these lasers 18 years later. So very, very good use, almost indefinite shelf life. These diodes are semiconductor diodes, laser diodes, no moving parts, no maintenance. In the last couple of years, a lot of the doctors have requested a laser to actually plug in the wall, and so what came about was the introduction of a DC console. So again, this is identical, same power, same wavelength. It has a digital readout on the dial, and in the very back it has a wheel that actually allows you to turn the volume up and down. So you can actually count, you can hear and see the doses as it's delivered. So it goes from 33 seconds down to 1. And this tends to be the most popular laser that they use right now, simply because the ease of use and being able to plug this in. Okay, there's some contact information, and first of all, I want to thank you for allowing me to join you today on the webinar. And I think you'll find that if you decide to use a laser in your practice, It's going to basically help a lot of people. I'm sure you have patients right now who would benefit from the use of a laser in the practice. And we will be having many more webinars. This is only the beginning. I think there's 7 or 8 more coming with Dr. Fellner, and then we'll be adding additional as we go through. If you have any questions about the laser, or if you want to get the protocols, please contact the webinar people at the end of the webinar, and they'll make that available to you. So again, thank you very much, and look forward to talking to you again. Thank you.